Our next session is on the ketogenic diet, and I'm pleased to introduce Robin Blackford, RDN LDN of Lurie Children's Hospital of Chicago. Robin has worked as the expert ketogenic dietitian at Lurie Children's since 2005. She's helped initiate and grow the formal ketogenic diet program, where the keto team there currently follows over 350 patients on ketogenic therapies, and has helped to make Lurie Children's one of the largest keto centers in North America. Robin has several publications on the ketogenic diet, including being an author for the International Ketogenic Diet Consensus Statement, and routinely gives presentations about the diet to a variety of audiences. She has a passion for setting up families to be successful with following diet goals, as well as supporting and mentoring other health professionals who guide patients with these therapies. Robin lives outside of Chicago with her husband and 2 teenagers and enjoys family vacations and game nights.
All right, thanks for joining me today. Today, we are going to talk about the medical ketogenic diet. So let's just start at the very beginning. What is the ketogenic diet? It is a high-fat diet that is low in carbohydrate and adequate in protein. So you can see the little pie chart there on how much fat it takes to qualify as a ketogenic diet. And actually, following this diet will cause your body to go into ketosis. Now, just as a reminder for all these macronutrients, the fat, carb, and protein, what are these foods? And just in case you're not familiar with it, a fat would be like heavy cream and butter and mayonnaise and oil. Those are high fat foods. Carbohydrate sources are usually bread, cereal, rice, pasta. Some fruits and vegetables also have a small amount of carbohydrate in them. And of course, sweets and high sugar kind of stuff also fall into that category. And protein foods are usually, think meats and fish and eggs and cheese. Those would be high protein foods. So when you follow this diet, you go into ketosis. So what is ketosis? It actually means that you are burning fat for energy instead of carbohydrate and sugar for energy, which would be, like your standard American diet that is, mostly based on carbohydrates, like if you think of the old food pyramid kind of thing, where all of your grains are at the bottom, those would be carbohydrate sources. So our diets are based on that, and we burn that for energy. This flips your metabolism so that you are burning fat for energy instead. So you reduce the amount of carbohydrate in your diet, replace those things with fat, and then your body only has fat to be able to run on. And ketosis and ketones are what are left over after that metabolism kind of happens. So you can actually measure ketones and the level of ketosis in your body either through blood or through urine. And officially, if you have a blood ketone level of greater than 0.5 millimoles per liter, then you are in a therapeutic level of ketosis. So you can be on a ketogenic diet or a version of the ketogenic diet and be in that state of ketosis for many different reasons. And as we know, that it treats a lot of different chronic illnesses. And of course, I would put epilepsy and seizures kind of in that category, but also maybe something like diabetes, or there's a lot of research coming out on autism and Alzheimer's and Parkinson's. There's a variety of reasons why you might want to use fat for energy. And also in optimizing both mental and physical performance. And I've even read some things on sleep where it can also be helpful for those things too. So while we know the benefits that are associated with being in ketosis, especially for epilepsy and treating seizures, we are not entirely sure about the mechanism of action. It's not very clear about those things. We are still researching those ideas. It just seems to be a very complicated and involved kind of process when it comes to our metabolism and maybe our gut microbiome and some neurotransmitters, very multifaceted. They haven't been able to really kind of nail it down to kind of like one mechanism of action quite yet. So the diet seems to enhance the ability of the mitochondria. So if you can kind of remember your science classes from school, you know, the mitochondria is that powerhouse of our cell. It is able to deliver our body's energy needs, and that kind of reduces inflammation and reduces stress in your body when we are in that state of ketosis. So now that we have a little background on the ketogenic diet, I want to talk to you about our program at Lurie Children's. And our current caseload of patients, as you can see there, is about 350 patients that we have on a ketogenic diet therapy. I've broken them down into two different sections. So KD is our ketogenic diet patients. There's about 310 or so of those patients. And then I say MAD, which is actually Modified Atkins Diet, is what it stands for. It's kind of a version of our ketogenic diet. And I'll talk to you about these two different diets and what they mean. But also that we have about 40 of those patients as part of our caseload also. So when we sit at about 350 patients on the diet, that makes us one of the biggest keto centers in North America, and probably in a greater way too, but we'll just stick with North America for now. So our keto team is made up of our nurse practitioners and also our registered dietitians. So you can see a picture there of Wes and myself when I had much shorter hair than this pre-pandemic. And so we have a couple of nurse practitioners that do our keto clinic with us. And also I put Wes and Robin for nutrition, but also two more because we have just been approved for two more registered dietitians to be able to join us. So with 4 registered dietitians running our ketogenic diet program, that definitely makes us the biggest ketogenic diet team in the world. So you can be assured that you would receive great nutrition care if you were able to start the ketogenic diet with us. I wanted to make sure that I mention that our team is very we're very serious about how diet therapy is actually your choice. It's your choice in your treatment. We don't make anybody start the ketogenic diet unless you really have bought into the whole idea. And we want to make sure that we tell you everything that you need to know about it before we even get started. So hopefully I'll do some of that here today. But if you come to one of our diet clinics, then you would be able to learn a little bit more that way too. So let's start at the beginning of a newly diagnosed patient. So this graphic actually comes from the Charlie Foundation for Ketogenic Therapies, as you can see there at the top. That is probably the best place to go for ketogenic diet information is the Charlie Foundation. So I would encourage you to find that website, thecharliefoundation.org, and go there and find out more about ketogenic therapies. So you might find yourself there on the very left-hand side in the newly diagnosed epilepsy patient group. And this is not specific to Dravet syndrome. This is for everybody. But when you get started to take the first medication that has been identified for your loved one, then you have about 47% chance of becoming seizure-free with that first medication. If you unfortunately end up in that 53% bucket of uncontrolled seizures, then of course your doctor is probably going to start you on a second medication. And you can see there, if you take a second seizure drug, then you are about 13% chance to become seizure free from that second medication. And then if you are unfortunately in that greater group, in the uncontrolled seizure group there at the bottom, and then you can see if you start your third medication or even more medications after that, your chance of becoming seizure free are kind of less and less. But the great news is that that's not how the ketogenic diet works. At the bottom there, you can see 10 to 25% of people that try a ketogenic therapy become seizure-free. And it doesn't matter where you are in the spectrum between, the first medication to, at the very end, additional medications, however many you try. It doesn't matter that everyone gets that between 10 and 25% chance of becoming seizure-free. So that is the very good news about using the diet as a therapy. So let's look specifically at Dravet syndrome. Does the diet work for seizures related to Dravet syndrome? And the very, very, very short answer is yes, it does. And actually, the epileptologist that I work with here, Dr. Linda Locks, and I put together a paper back in 2013 describing our patient population that has Dravet syndrome and was also on the ketogenic diet. And what we found was that 65% of children with Dravet syndrome at our center experienced greater than 50% reduction in their seizure frequency, which are amazing percentages. And most of the patients that have Dravet syndrome end up in this, what we call intractable epilepsy, which means that the patients are not responding to the first and second medications, that they become intractable, and that might be a good time to start the ketogenic diet after you've tried a very good first and second medication. I've definitely started it after one medication on a lot of patients, but I think that our medications are very targeted for certain things these days, and so we definitely start talking about the ketogenic diet very early on in the diagnosis, but sometimes it takes a couple of months to get to the point where we would actually start it. So trying very good medicines up until that point are definitely doable. But these are great numbers, I would say. So a question that I get quite often is, Robin, what's the difference between what you're doing at Lurie Children's for your patients with seizures and what I'm finding on the internet? Just your run-of-the-mill ketogenic diet for weight loss, whatever you want to call it, for bodybuilding. At one point it was, just fill in the blank for this kind of, ketogenic diet. What's the difference? And I say very simply, it comes down to kind of two things. It's about the percentages of fat and protein and carbohydrate. So those macronutrients can be in different varying amounts, depending on why you are using that ketogenic diet. So it's purpose. Of course, somebody who has seizures that we're using the diet for might have, a 90% fat diet. And it needs to be that high because of the amount of ketosis that we need to have in order to get the best seizure control. Somebody who is using the ketogenic diet for a brain tumor may have a different percentages of fat, protein, and carbohydrate, and kind of when they use it or why they're using the diet. So I'm not going to prescribe this exact same diet for those two patients. There's going to be a lot of similarities, but not the exact same diet. So I think it's good to know that there are going to be some differences in these diet therapies. One of those things is the ketogenic ratio. So this would be for the classic ketogenic diet. the one where you are in the hospital to begin the diet, this medical ketogenic diet, we think of it in terms of ratios. So I think the best way to describe it is, if you think of the amount of medication that you're taking, it's so many milliliters of X amount of medication. We think of the diet in the same way. This is the ratio of the diet is a certain ratio, like it's a certain amount of medication. And if you are continuing to have seizures, of course, you would increase that medicine, you would increase the ketogenic ratio. So that just means it's the amount of fat to non-fat that's in the diet that's made up, like if you're thinking of a plate of food. And a common ratio might be like a 3-to-1 ratio or a 4-to-1 ratio. So 4 parts fat to 1 part non-fat. And that non-fat portion is carb and protein added together. So it's not just the amount of carbohydrate that we're worried about. We need to know how many grams of fat and carb and protein so we can set it into this perfect ratio and know exactly what that dose of the diet is going to be. So a 4-to-1 ketogenic ratio would be about 90% of fat calories and 10% is carb and protein, kind of that added together. So really, when you think about carbohydrate then for your entire day, it might be anywhere between 2 and 10 grams of carbohydrate for the whole day. And any of you out there that are kind of like carb counters that know how much carb are in things, 1 slice of bread is usually about 15 grams of carbohydrate. So we're thinking, so we're saying that somebody on a ketogenic, higher ketogenic ratio would take even less amount of carbs than what is in 1 slice of bread for the entire day. So that kind of gives you an idea of what those totals might look like. So an avocado, which maybe is a very ketogenic food. An avocado is a 4-to-1 ratio all on its own. It's kind of the only food that I know about. It's easy to add it to diets. It's very healthy. It's great for constipation or diarrhea. It's good for gut health. And there are not many foods that meet the good qualities of avocados like this does. But when we're prescribing a ketogenic diet ratio, like a 4-to-1 ratio, you have to add foods together to kind of create this ratio, right? So we have to take a fat source like butter, and we have to take a carbohydrate source like green beans, and we have to take a protein source like turkey or something else. But you add all of these things together to create that 4-to-1 ratio because usually foods just aren't, like an avocado, aren't set into that ratio all on its own. And then all of these things then are going to be weighed out on a gram scale. So this is kind of what it looks like if you put it on a plate. So our reference meal is on the left. That's chicken and pasta and green beans, a little bit of butter there on the top of it, just so that you can kind of see what it would look like if you were cooking with these things, and a glass of milk. On the right side, you get kind of that same idea, but this is the ketogenic diet in a 4-to-1 ratio. So you can see how much butter is there to kind of make sure that you get that 4 parts fat to 1 part non-fat. And what's in the cup there is actually heavy whipping cream instead of milk. So you can just drink your cream. And then, you can melt some of that butter if you wanted to. They put it on a plate like this just so that you can see how much it is. But a lot of our kids will just eat straight butter. So, it's not really that bad. So you can also just eat it, or you can melt it down and kind of eat it with it. When I create ketogenic diet meals for our patients that are eating food by mouth, then I kind of put them in these categories. And these are just ideas. This isn't an exhaustive list of foods, just some good ideas. So I pick a protein food for them. I usually like to use things that they already like to eat. And sometimes that ends up being hot dogs. bottom. I also pick a carbohydrate source. So you can see most of those are just fruits and vegetables that become their carb source. We do need a little bit of carbohydrate. It can't be zero carbs. It has to be some, but usually not your bread, cereal, rice, pasta kind of group. Then we have the heavy whipping cream, which is very typical. A lot of our kids will just drink it. It's not a lot. It ends up just being like a couple of ounces. Of course, we're weighing everything in grams on the gram scale, but it ends up just being a couple of ounces, not like giant glasses of cream. Or you can freeze it and make it into ice cream. People get very creative in the way that they put together their ketogenic diets, and also a fat source. So usually a butter or mayonnaise or an oil to kind of put together the correct ketogenic ratio that you've been prescribed. I use a keto diet calculator in order to do that so that everything is very, very precise. So we create these meal plans, as you can see here. This might be a typical lunch for someone. The food items are cream, an apple, some tuna, and some mayonnaise. Sounds like a very simple kind of a meal. And you can see the gram amounts for each one of those things. And that's what we would weigh on the gram scale. We'd weigh 31 grams of cream, and we'd take that off the scale. Then we'd weigh 27 grams of apple, and then take that off the scale. So you do each thing, and then you can kind of mix them together. So of course, we take the tuna, we take the mayonnaise, we'd mix them together. If they wanted to eat that with an apple, fine. If they want to eat it on the side, that's fine. It all just has to be consumed together. Because as you can see in the yellow line there at the very end, it's a 3-to-1 ketogenic ratio. So all of these things have to be consumed together to make sure that you are eating that correct ratio so we can keep the same level of ketosis all throughout the day, just like you were taking your medicine all throughout the day. It works in the same way. So here's just an idea of what different ratios might look like. I'm just going to breeze through this kind of quickly, but at the bottom right, you see the 1-to-1 ketogenic ratio. It looks fairly normal: chicken, broccoli, maybe some, like dipping sauce of mayonnaise kind of thing. A standard American diet doesn't really hit a ratio at all. This 1-to-1 ratio might be very similar to like a modified Atkins diet. Something that's very low sugar, low carbohydrate, just a general low carb kind of a diet with no grains or anything in there. And then you kind of go around, there's a 2-to-1 ratio, the 3-to-1 ratio at the top, and then the 4-to-1 ratio on the side there. So you can kind of see what happens as you increase the ratio and what that would look like on a plate. Of course, that is some oil that's in a syringe, and a lot of our kids will because they're taking medication by syringe, it's nothing for them to take, their oil by syringe also. It's very normal for them to be able to do this. It's a very easy way to get the fat in as part of their ratio without having to, maybe eat lots of butter if they're not good butter eaters or something. But what I really like about this slide is that if you look, all of these plates actually are 400 calories, each one of them. So if you look at the green and the red, they're very different ketogenic ratios, different looking on the plate, right? The 4-to-1 ratio doesn't take up a lot of room at all, but it's still 400 calories, just like the 1-to-1 ratio. And the reason for that is you get more fat and you get more bang for your buck in calories when you use a lot of fat. So all the portion sizes are fairly small. It just kind of tricks your eye into thinking that it's less food when actually a plate like this would fill up, even an adult person at a 400 calorie meal. So I want to take you through very quickly kind of like the different ages and what it would look like for a ketogenic diet at different ages. We do the ketogenic diet for infants quite often. I like to start the diet as soon as possible and not wait too long before, children have preferences and know that they're changing their diets. Start them before they're 3 years old, if at all possible. So we have breastfeeding infants and we have bottle feeding infants. We use a ketogenic formula that is called KetoCal quite often. It's made by a company called Nutritia, which you can find on the internet also. But even for breastfeeding infants, we do, it's hard to measure. You can't measure the amount of breast milk that those infants are taking, but we can still get them into a lower level of ketosis and work with the ketogenic diet while they're still being able to be nursed. So it definitely is a possibility. And of course, for older infants that are eating pureed foods, baby foods, there's some peas there in that picture. Of course, we want to set it to the right ketogenic ratio. We can't just eat vegetables. We can't just eat peas. We have to match it to a fat source. So oftentimes what I do for our infants is I'll tell you to weigh a certain amount of butter and a certain amount of, let's just say peas. And then you mix them together. And that way you've got the right ketogenic ratio in that bowl so that every bite that they take is then in that correct keto ratio. And that's typically how we do keto for infants. So keto for toddlers looks a little bit different, but might, for the younger toddlers, might carry over some of those things that the infants are still doing. So we can definitely still give sippy cups full of the ketogenic formula. That's absolutely fine. There's a lot of vitamins and nutrients in that ketogenic formula that they add to it. So we can actually continue that for quite a long time, and that's okay. It would just replace maybe some milk in their diet. But we can use the sippy cups. And for children that are learning to use that pincer grasp and pick up foods on their high chair, we would just dice up some vegetables or even, some really soft cooked vegetables that they can then pick up and still eat. Of course, everything's weighed on the gram scale, so we have to know exactly how much that is. And then if we drop one or the dog eats one, then we kind of have to replace it. But you get pretty good at doing those things. Of course, if we're using still some of the Gerber purees in the jar, we can absolutely do that. And we just, weigh out the amount of butter that we need, mix them together, just like we were doing before, at just varying levels of stages of the Gerber foods. For our school-age children, we can, send all of the foods from home to the school. We don't have them do any of the school meals at all because it's just not going to match their ketogenic diet exactly. So, here's a fun little bento box full of their ketogenic diet with all the fat that's in there too. So that's definitely something creative that you can do. You can keep it very simple, and we can just have hot dogs. That's absolutely fine. But like I said before too, a lot of our school-age children will just eat butter. So you can put them in little molds. And we can, sweeten them up with some keto-friendly sweetener and maybe a little bit of cocoa powder and make them into little butter chocolates. And, I'm just really amazed at what families have come up with in the many years that I've been doing this. And so a lot of them will also just drink the heavy cream alongside of their meal. For teenagers and adults, I don't know how many we have on the call here today, but it's definitely doable. And I would say that we probably use a little bit more of like that modified version of the diet than the regular medical ketogenic diet. So we use things like Carb Manager and MyFitnessPal to kind of help track some of these things. There are a lot more choices that teenagers and adults would have on their own. And of course, for those teenagers, if they're able to learn how, then that's, giving them a little more responsibility is a plus. And I'm not going to forget about my tube feeding friends. At any age, we can do the ketogenic formula by an NG tube or a G tube. If you're an infant, if you're an adult, it doesn't matter. We can help you get into ketosis with a tube feed also, and not to mention also so all those food pictures that you just saw, we can put those into a blender and create a blended ketogenic diet also. So we don't have to use the formula if we don't want to, or we can use both. So oftentimes you will test urine ketones at home. This is something that we can do for anyone. That little strip there is something that you would either pee on, or if you have a child that's in diapers, you just put a couple cotton balls in the diaper, and then you'd press that little strip into the cotton ball, and it's going to change color. And then you can kind of see on the color strip here where you are in ketosis, and just so that we can keep a consistent level of ketones in the body for metabolism at all times. Our process is like this, which is also on our website. You kind of come and meet our team, you learn more about the diet, and then we set up the hospital stay, which is a 4-day admission to the hospital to begin the diet. I teach you everything I know about the ketogenic diet, send you home on day 4 with your child who is in ketosis and doing well, and you've learned everything about it and all the home management. And then we do a follow-up in about a month and get some blood work associated with that. Right now, all of our outpatient visits are telemedicine, so you don't even need to come into the hospital and come see us. We can just do it on video. And then our ketogenic diet team is available all the time that you would need any kind of support or questions or anything at all by email or the electronic medical record, the MyChart, and also just plain old telephone calls. Something to remember about medications is that it's not only just the all of the food that you're eating. We also need to take into consideration the medications that the child is also taking. All of the liquid medications have sugar and carbohydrate in them, so they taste good, so kids will take them. So we usually have to change all of the liquid medicines over to tablets. And what we do is crush them, and then we can put them in food, or we can put them in liquids. We can, just put it right in the syringe and let it kind of melt in there and dissolve, and then syringe those things. So that is something that we teach you how to do during that inpatient stay also, and kind of practice with those things. But oftentimes we're able to reduce the amount of medication that our patients are taking if the diet is helping with seizure control. So reasons why we might stop the diet, or maybe wean back on the diet, or maybe even reduce the ratio is if it's not working. If the diet is not working to help with seizure control, you get no benefit from it whatsoever, then of course we would wean it down and we would stop it. We'd also stop the diet if it is working. So for both reasons, but we would probably stop the diet after a few years. And we definitely have patients that have been on it for years and years and years, and they're perfectly happy being on it. It's not a problem for them to follow this for many years. But if we're able to wean down some medications, that takes a little bit of time. We do that in conjunction with the doctor, whoever you're following with. And then you're still seizure free and you're not on any medications, then we might then go after the diet and try and wean down the ratios. So if you're at a 4-to-1 ratio, then we take you down to maybe 3.5, and we'd wait a month, and then we take you down to a 3-to-1 ratio and just keep going. So that might be a few years into the diet. We might stop the diet because of different social barriers or limited resources for any reason. Of course, we try and work with you with some of these things first before we would just end the diet. But a family request, you're just done with the diet, that's fine. Of course, we talk about all these things in great detail before we would make these decisions, but and see where we can help you. But also possible side effects. So I want to make sure that I review some of those with you too. Probably the most common side effects are listed here. Constipation is probably the biggest one. So if you go into the diet and you're already constipated, probably just going to get worse. We'll look at fluids, we'll look at different foods that the child is eating and see if we can increase the amount of fiber. If not, then we have backups with stool softeners to be able to prescribe in that case. Low blood sugar is a possibility, but of course, when you're in ketosis and you're not eating a lot of carbohydrate and sugar, then you do have a lower blood sugar level kind of all of the time. So actually, when it's a problem, probably only when you're first starting the diet, when you're still in the hospital, and then we can kind of help treat that and get you on a good level. But lethargy, maybe just to start the diet when you first go into ketosis before your body really gets to know what it feels like. There's drug interactions that we need to watch out for, and also metabolic acidosis, so a low carbon dioxide level of your blood. So this is why we do labs. We get initial labs, we get labs 1 month after the diet starts, and then maybe about every 3 months after that, just to kind of keep tabs on some of these things. So that's why I say don't initiate the diet on your own. Please do this in conjunction with your doctor and hopefully your keto team so that they can be able to treat your child very specifically with what's going on. Vitamin deficiencies and high lipid levels are possibilities, especially at the very beginning, but we expect cholesterol and triglycerides to actually go back down to their normal levels by after a few months into the diet. A lot of these side effects are very short-term and acute and reversible. We know what the side effects are. We know how to treat them. So it's not like anything is a surprise when we see it, and we know exactly how to take care of it and hopefully are proactive enough so that it never happens in the first place. So to tie this all up, I have just a piece of advice for you, and that would be find your team. Find who you're comfortable with, who you want as your child's team, and go ahead and ask them the hard questions. I love it when patients' families ask me hard questions because it's a privilege to also be a part of your team. So go ahead and ask me these hard questions, either about the diet or about my practice, about myself. That's fine. I encourage those things, and I encourage you to find your keto team also. There's a lot of neurologists and epileptologists out there that might prescribe the ketogenic diet, but might not have a team associated with their institution. So I'll let you know that you can always come here to Lurie Children's. You do not need to see our doctors, our team of doctors, in order to be on the diet with us. You can see your local neurologist, your local epileptologist, whoever you're comfortable with, and then just come and do the diet with us. Our team and our nurse practitioners will talk to your neurologist at home. So, that makes it a nice relationship. And just double check everything before believing anything on the internet. It is 2021, we're going to 2022, and we can't believe everything on the internet. So please, even if your child isn't followed by me and you want to ask some questions, please go ahead. I can double check them for you if you're finding things on the internet that you just want to make sure by an expert. I'm happy to help you. So here is my contact information. Thank you so much for listening. I know I went over some on the time here, so thank you so much. Feel free to email me at my Lurie Children's email. Our Epilepsy Center office phone number is there. You can find me also there. If you go to the Lurie Children's website and you just search for ketogenic diet, my information is also there too, so that you can find our team. Thank you so much for your attention.
Thanks, Robin. We often have families reach out to us with questions about the keto diet and its use with Dravet syndrome. So it's really helpful for us to have this information to share with them as they start to explore this as a possible treatment option for their own child. So we did have a few questions that came in. I'm going to start off. The first one was, how can I start my child on the keto diet? And is this something I can do on my own?
So I wouldn't suggest starting ketogenic diet on your own. I think it's perfectly fine to go ahead and, gather up some information about it. And like I had said in the video, that the Charlie Foundation is probably the best place to go to start gathering up that information. But, I wouldn't suggest starting it on your own, just like you wouldn't start a new medication on your own. I would say, it's probably not the best way to go about doing it, is to start the diet on your own, but in conjunction with your doctor and hopefully with a registered dietitian and a keto team.
So if my son does well on the ketogenic diet, does this mean that we can take him off of all of his other seizure medications?
Quite often we can reduce the amount of medication that our patients are taking when the diet is helpful. We usually stay with the amount of meds that they're taking at the beginning of the diet. And once the diet is, kind of in full swing, then we can start reducing some of the medications, especially, the first one that maybe isn't that helpful would be the first one to start being weaned down. And we do that in conjunction with the doctor. Yeah, as many medications as we can take off over the course of time, if the diet is helpful, then the better.
And then this parent said, my son is a very picky eater. What if we try keto and he just won't eat?
I think that's a very common concern. And, as you can see, that the portion sizes of the ketogenic diet are pretty small because you get a lot of calories with the fat. So, even if it's small portions of foods, or, we'll pick your child's favorite foods and use them as part of their ketogenic diet. But we have lots of tips and tricks that we can kind of do. And I think that having conversations with your keto team about those things are helpful. But we can get around a lot of those things. And even though the picky eaters, I feel like every child has their quirks when they're eating, that we can kind of work around some of those things. And I think that's also where your keto team can be really helpful, because we have lots of ideas that we can try.
Great. And the last question is, what is the best age to start the diet?
I like starting the ketogenic diet as soon as possible. Like soon after diagnosis, we have a couple of medications that we can try that would be the best targets for certain seizures. And I think talking about the ketogenic diet soon, just as a possibility, an option in your back pocket, just in case, is probably a good idea. But my favorite time to start the ketogenic diet is 3 years old or younger, because they really are eating whatever you give them at that point. And the older that they get, the more preferences and things that they know that they're missing with the diet that you have to kind of think up and get more creative to do.
That's great. Thank you so much again for joining us, Robin, and sharing your expertise. We really appreciate it. And with that, we'll turn it over to our next session.
Thank you.